Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
All right, good evening. Thank you for joining us for Sports Doctor. Hope everyone had a good holiday. We're back to work here. It's brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Pennsville. Also coming soon to Vineland and Swedesboro. During this half hour tonight, we're going to be talking about shoulder injuries. So if you're having problems with your shoulder, we urge you to call in. Our toll-free number is 1-888-634-7488. That's 1-888-634-7488. Answering your questions tonight, we have Dr. Merrick Wetzler, who's an orthopedic surgeon. He's with South Jersey Orthopedic Associates in Washington Township and also in Voorhees. And next to him is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Before we begin, let me remind you that Cross Keys Physical Therapy is offering free screenings for the next 2 weeks. And at the end of the program, or actually even during the course of the program, we'll put the numbers up for the various centers if you'd like to schedule an appointment. That's all you need to do to take advantage of that offer. Take advantage of our offer tonight on a free question, 1-888-634-7488. Before we get to the phone calls, though, Dave, give us the anatomy of the shoulder joint, please.
I'll give you a brief anatomy. This is the right shoulder. This is the humerus or the arm bone. This is the shoulder here. It's the head of it. This is the scapula, better known as wing bone. This is the clavicle, better known as collarbone. It's the acromion process, coracoid process. These are some of the musculature here of the rotator cuff. This is the supraspinatus muscle. This is supraspinatus tendon right through here. This is the long head of the bicep. Subscapularis muscle here in the tendon. Infraspinatus right here. And it attaches right over here. That's a basic anatomy of the shoulder joint.
And you know, when you talk shoulder problems, a lot of people think right away of the rotator cuff. Dr. Wetzler, what is the rotator cuff and why is that so important?
Let me just give you, we'll go back to anatomy for a second. If you're describing the shoulder joint, the way I describe it to most patients, it's almost like a golf ball on a golf tee. It does not have a lot of inherent stability. There are two things that stabilize the shoulder. The first is the static stabilizer, which is the ligaments. But the ligaments are not that tight because the shoulder, as we all know, has the greatest range of motion of any bone in the body. Therefore, the dynamic stabilizers are called into place. The dynamic stabilizers are the rotator cuff. There are four muscles: the subscapularis, which sits in the front; the supraspinatus, which Dave showed you sits on the top; the infraspinatus and teres minors are on the back. The subscapularis rotates your arm in. The infraspinatus and teres minor rotates the arm out. And the supraspinatus brings your arm up from the side. Now, these muscles have to fire to keep the shoulder in place during activities such as throwing and swimming and so forth. And as you can imagine, they have to constantly fire. Through their process of activity and overuse, they can get swollen. Now, as you can see here, this is a finite space. If you can focus in, yeah. This is a finite space. The acromion and the coracoacromial ligament form the coracoacromial arch. This space gets no bigger, no smaller. It stays the same. What gets bigger with inflammation is the supraspinatus tendon. And as you bring your arm up from the side, you can see how it can pinch against this arch. And if you keep pinching it, what happens? It gets more inflamed. By getting more inflamed, it gets more swollen and pinches more. So it's a positive feedback loop. So that's really what stems and causes shoulder problems.
Okay, now as far as the rotator cuff, what does that do?
The rotator cuff brings your arm up your side, keeps your shoulder in place, and makes sure that the glenoid and the humerus remain in contact.
Okay, now as far as rotator cuff injuries, Dave, what are some common ones that you see?
Well, as the doctor nicely explained here, that because of that narrowing space between, the most common thing that we see is the impingement. And when you have impingement, you get inflammation that forms in there. So that is the main thing that we see. We see a lot of impingement, and it's mainly because of a lot of repetitive activities, the overhead activities these people have as far as their jobs requirements. As carpenters or electricians, they do a lot of overhead activities, and they do it over and over and over again. and they're using their dominant arm all the time, it becomes inflamed. And
What about tears, Dr. Wetzler?
Well, the tear, I mean, and if you just keep moving your arm up and down, up and down, up and down, it's like I explain to my patients, if you take a rope and you put it over a door and you just pull the rope up and down, there's really no sharp edges, no nothing, but due to friction, due to wear and tear, that rope will eventually break. And the same thing with the rotator cuff. If you keep bringing your arm up and you keep pinching it against the acromial arch like we talked about, that will cause a tear, even though there might not be a traumatic injury. Now, you have the traumatic injuries, you know, like Chad Pennington of the Jets. Hugh Douglas is another one. What happens if you have a fall and your arm is jammed down, you can get a rotator cuff tear as well. So you can have the chronic type of tears and you can have the acute type of tears.
So are there different degrees then of tears?
Not different degree. Well, there's different degrees of what we call impingement. There's 3 types of stages of impingement. One is, stage 1, of course, is just what we call the inflammatory stage of impingement. The inflammatory stage of impingement is usually reversible. The rotator cuff is just inflamed. And by doing anti-inflammatories and physical therapy is real important at this point, because you need, the way the body heals is in line with stress. And you have to exercise the muscles so that when the tendons and the muscles heal, they heal in an orderly fashion. If they don't heal in an orderly fashion, or they don't do things to help it to heal, you get into stage 2, which is the fibrotic stage of impingement. Now you're at irreversible changes. Now you have an inflamed or larger rotator cuff passing through the same space. And at that point, usually non-operative treatments fail. And what we have to do for that is make that space bigger by shaving down the bone and releasing the coracoacromial ligament. Now, stage 3 is the tear. And again, that's again a more operative treatment modalities on that, in that case.
What is the surgery like for rotator cuff?
Well, surgery is an ever-evolving art as much as a science. We use science to help us with technology and develop our skills, and art is defining what the tear is, what it looks like, and how to fix it. Nowadays, myself, as a fellowship-trained surgeon in sports medicine, I do about 90% of my tears through arthroscopic methods. That means no real big incisions, 3 to 4 small incisions using devices that go through cannulas into the area, and I sew the rotator cuff back to where it inserts.
Okay.
Now, but let me just say that. I say that, and that's the way I do it. The results of doing open repairs compared to doing arthroscopic repairs, even though the patient does hurt less when you do it arthroscopically, if you do it open, the results are fairly compatible. So I think the way I do it is better, but other people in their hands, they do it away, and they have could have similar results as I do.
Okay, we're talking shoulder injuries tonight on Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Our toll-free number, if you have questions about a shoulder problem you're experiencing, is 1-888-634-7488. Talk about the therapy, David, for a person who has had rotator cuff surgery. How long does the physical therapy afterwards, the rehabilitation process take?
Well, I think it really depends on a couple different factors. First of all, what type of tear it was. I mean, where is the tear at, how severe it is, and that's where the communication comes between the physical therapist and the surgeon. We always communicate well with them to find out how severe it is, and usually they'll write to us a pretty detailed prescription and telling us, well, you know, we want to be more conservative with this patient, or you can be a little more aggressive with this patient, depending on the size of the tear. And as far as rehab goes, it really depends on, obviously, the person himself. People that are in really good condition, that have exercised prior, will usually rehab back faster than someone that hasn't, for several reasons. One, they can tolerate the pain a little bit better because they're used to doing some of that stuff and working out. 2, they have better blood supply and better muscle tone. That's real important when you go to rehab somebody. The muscle tone is real important. If they're better muscle tone, the easier they're going to be to rehab back. They don't have to go through those soreness things and stuff like that. They're already in shape. So that's why the athletes rehab back faster.
I mean, one thing about rotator cuff surgery, it is very painful. I mean, but the alternative of not repairing it is worse. So if you do go through the rotator cuff surgery, repair, no matter what method you use, it's going to be a long rehab, and it's painful. So if you really, don't blame the therapist for putting you in pain. You got to blame the doctor, okay?
But it's something, it's not going to go away
You
by
can't,
itself.
there's not an alternative there.
Okay.
Yeah.
Our toll-free number is 1-888-634-7488. You're watching Sports Doctor. We're talking shoulder injuries. We have Dr. Merrick Wetzler with us. He's an orthopedic surgeon from South Jersey Orthopedic Associates, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. On the line, we have Frank from Lawrenceville with a question on Sports Doctor. Frank, thanks for calling. What can we do for you tonight?
Yes, this is directed to the doctor. What my question is that I've had an MRI of my shoulder and the cup, and I've been told that there is a slight tear. My question is, do I need to have surgery, or can that be repaired through physical therapy? Dr. Wetzler?
Well, it's not going to be repaired through physical therapy. The question is how old are you, Frank?
In my 60s.
How physically active are you?
Oh, not bad. Okay.
Does it affect your quality of life, your shoulder?
Oh, yes.
And have you tried physical therapy?
No, I haven't.
I think the first stage is someone at 60 years. And the question is, you got to weigh your physical activity, your physiological age more than your chronological age, and see how you do it. Probably the first line I would try with you is give you an injection, send you to therapy, see how you do. And now, if you after 6 weeks you're still having problems, still affects your quality of life, then I would say, hey, you know, I don't think this is going to get much better with non-operative treatment. Then I would try surgery.
Frank, thank you for watching. Thank you for the phone call. Don't forget, Cross Keys Physical Therapy offering free screenings for the next 2 weeks. We'll give you the numbers to schedule an appointment if you'd like to do so. Our toll-free number right now, 1-888-634-7488. Let's talk to Mike in Philly. Mike, welcome to Sports Doctor.
I'd like to make a call.
Mike, were you there? I think we lost Mike. Oh, well. Toll-free number again is 1-888-634-7488. What about Dr. Wetzler, things such as tennis elbow, golf elbow, pitcher's elbow? What are the medical diagnostics for these companies?
There's a little difference between a pitcher's elbow. Let's just talk about medial and lateral epicondylitis. Lateral epicondylitis is what we classically call tennis elbow. Golfer's elbow is medially, actually, and tennis players can get both. They call it, I don't know why I got the golfer's elbow, just to differentiate from tennis elbow. Basically what happens is that the muscles that insert onto the lateral epicondyle are the muscles that make your wrist go like this. So anytime you're picking up an object, those muscles have to work, okay? Anytime you turn something, anytime you move your fingers, those muscles have to work. If you're playing tennis, and I happen to be left-handed, and you're hitting a backhand, boom, every time you do that, it's going to hurt. And what happens is that every time you do it, you're going to have a little bit of microtrauma. And if the microtrauma is larger and more repetitive than the body's ability to heal, you will develop scar tissue over the lateral epicondyle. And that scar tissue will be painful and so forth. At that point, you need to, again, we need to remove that scar tissue. We need to heal it. And the best way to heal it is to give it some type of anti-inflammatory, whether it be by the oral methods or an injection of steroids in that, which is, steroids is an anti-inflammatory. And again, physical therapy. Again, like I said, the body heals in lines with stress. You need to stretch it, you need to strengthen it, you need to stimulate healing in that method. If that fails, and it usually in about 90% of the patients, 95% of the patients, that works. If that fails, there are actually a very new technology out there called radiofrequency treatment. The device is called the Topaz unit. And I've had some really, really good results with that. We used to, when we do surgery on the elbow, I used to have to detach the tendon, scrape the bone, remove the scar tissue, and then reattach the tendon. Right there, that sounds pretty traumatic. And now with this new unit, I just have to release the fascia around it, take the scar tissue off the top of it, and then what I do is, again, I stimulate healing. By using this radiofrequency probe, it has been shown to really stimulate healing. And where it would take a year to get people back to doing the norm, I'm having people back to playing tennis in 3 to 6 months.
Okay, that's good. We'll have to hear more about that, I'm sure, in the future. Our toll-free number is 1-888-634-7488. Gary's on the line. Is it from Pennsville? Gary, are you there?
Yes.
Hi, go right ahead with your question.
Yes. Yeah, I was told I need a artificial shoulder because I lost most of the blood flow to my shoulder.
Well,
And I was just wondering what the prognosis is for artificial shoulders. I see very few of them around, and I don't know anybody who has them. I have an artificial knee, and it works really well. But shoulders, I haven't heard too much about. Now, I'm hesitant to get it done, but I really do need it.
Is that the equivalent of shoulder replacement?
yeah, shoulder replacement.
Okay.
Well, a lot of times the shoulder's a non-weight-bearing joint, so a lot of times we only have to replace the ball. It sounds like, Gary, what you have is avascular necrosis, which is the head of the humerus, lost its blood supply, so the bone died and so forth. There are a couple of alternatives to total shoulder replacement replacement. There are resurfacing devices as well that are less traumatic and help your shoulder as well. I can't tell you which device is best for you, but if it's affecting, like I said to the gentleman with the rotator cuff tear, if it's affecting your quality of life, shoulder replacement has been around for years and years and years. It's not a new technique. What you should do is make sure you go to a person who is comfortable doing shoulder surgery, such as someone who's trained in sports medicine or someone who's trained in shoulder and elbow.
All right, good luck. Thank you for the phone call. And don't forget, Cross Keys is located in Pennsville, also in Woodbury, Washington Township, and Sicklerville. Let's go across the river to Delaware. Victor's on the line. Victor, what can we do for you tonight on Sports Doctor?
This is Victor.
Victor? Do we have him? I think there's a problem with Victor's phone. Anyway, our toll-free number is 1-888-634-7488. Dr. Merrick Wetzler, a guest, an orthopedic surgeon from South Jersey Orthopedic Associates in Washington Township and Voorhees, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy in Sicklerville, Woodbury, Washington Township, and Pennsville. What about, Dr. Wetzler, things such as tendonitis of the shoulder or elbow? What do you do for people with that?
Well, again, you have to examine, you have to treat every patient as an individual. You have to treat them that way. You have to see where the source of the tendonitis is coming from, whether it's anatomical, whether it's based on overuse or maltraining, or whether it's based on other factors. I mean, people who have shoulder pain can sometimes have stuff coming from their neck. Could have a herniated disc in their neck. I mean, the most commonly herniated disc in the neck is the cervical fifth and sixth nerve, and the disc between the cervical fifth and sixth vertebrae. And that's the same innovation for the rotator cuff. So someone who has a herniated disc can also have rotator cuff pain and so forth. So you have to find out where the source of the pain is, treat the source as well as treat the symptoms.
Okay, we'll get to rehabilitation, Dave, in just a second, but first we're going to take a short break. You're watching Sports Doctors. Tonight we're talking shoulder injuries. Our toll-free number is 1-888-634-7488. Stay with us. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Washington Township, Sicklerville, Pennsville, Woodbury.
All right, we're back on Sports Doctor, and I think we've got Victor back as well. The toll-free number is 1-888-634-7488. Victor, are you there?
Up and try again.
What's with Victor tonight? Toll-free number 1-888-634-7488. What about rehabbing someone with tendonitis, Dave?
Well, I think it was real important. I think I really like what Dr. Wetzler said. I think it's so important to get a thorough evaluation for them, because I think that through the evaluation you're going to find out what really has caused the problem. Like the doctor said, if you just treat the symptoms, they're more likely going to come back. You really got to find out what caused the problem. So once you find what caused the problem, you correct maybe the body mechanics, whatever it may be, to do that, or maybe it was something they were doing in particular as on their job. that we can maybe alter it a little bit to prevent that from happening again, and then treat the symptoms. But what we do in physical therapy, we really basically look at the limitations. What's the limitations? Is it inflammation? We'll use a lot of modalities to decrease the inflammation and work on the range of motion and stretching and get into their strengthening as well to try to stabilize that joint to get it back to normal again.
And this is something you can look at during that free screening offer as well,
right.
that we're talking about and offering, and I urge you to take advantage of by contacting one of the centers. The numbers are up on your screen. Right now, our toll-free number, 1-888-634-7488. Robin is our next caller. Is it from Gilbertsburg, Pennsylvania? Robin, are you there?
Yes, I'm here.
Hi. What can we do for you tonight?
I have a question. I went shopping Black Friday, and I tried to lift a heavy box and put it in my shopping cart.
It was a computer, right?
Uh-huh.
For $400.
I didn't realize how heavy it was because I never lifted one up before, but I kind of really reached around it and picked it up, and I realized it was way too heavy, and at that point I knew I hurt myself, and it felt like I strained my shoulder blade or pulled it out, and it felt like some of my ribs had either broken, like a stress fracture, or muscles had torn, and I've had a hard time, getting rid of the pain. And how long does it take for something like that to heal?
Yeah, is this, I guess she should see somebody, right?
I mean, absolutely. At this point, it's been almost 6 weeks, Robin, and you're not that much better. It all depends on, again, where it's hurting you. If you're hurting on the medial side of your scapula, your shoulder blade, so if you're hurting, here, Dave, if you're hurting like right here in the back, that could be more coming from your neck. That's a lot of times. If you're hurting more right here on the lateral aspect of your arm, that could be more from your shoulder. It's hard to say from your ribs. Your ribs, when you lift something, twist something like that, you can injure the cartilage that's between the ribs. And so it's hard to say exactly. But at 6 weeks now, and you're still hurting like that, I would call your family doctor, or if you have an orthopedic surgeon or a physiatrist or even your family doctor, you should go in, get checked out, and get properly evaluated.
A shopping injury tonight on Sports Side. I'd say that Black Friday, that could be pretty heated stuff, right? Toll-free number, 1-888-634-7488. Dave from Audubon. Dave, are you there? Dave, you're on Sports Doctor.
Hi, good evening. How are you?
Good. How are you, Dave?
Good. I actually had a shoulder surgery repair done by Dr. Wetzler about a year ago. I'm a year out. And PT went fine. Everything went fine. But I sometimes do the exercises and ice it. But in PT, they did the stimulation that can actually help. They attached, some unit, a TENS unit or something. What about continued use of that? Are there home options for that, or is it something that you wouldn't suggest doing?
There's TENS units for home use. I'm not too familiar with the long-term use of it. Dave, are you?
Yeah, there are home units to use it, but really what the TENS unit really is it's really, it blocks the pain. That's really all it's really doing for you. I mean, your receptors go from your brain down into the area, and it's blocking that receptor back up to your brain so you really don't feel it. So long-term, the more you use it, the less effective it is. So in reality, you really don't want to use it that much. Really what it's really used for is to get you through periods of time where if you have to sleep and you can't sleep, it's used mainly for there, but it's really not to be used during time of working where you're going to be able to block the pain and enable you to do something that maybe you're injuring the shoulder even worse, so you don't want to do that. So there's some positive, negative things about it, but long-term effects, I don't think you want to be using that on a long-term effect. So I think you might need to, if you're having that much pain, I mean, I don't know how much exercise you're doing again. Maybe you might need to come back and see Dr. Wetzler again to see really what's going on with your shoulder.
I mean, it's funny when you talk about that. Even after you have a rotator cuff repair or surgery, if you go back and swim and you overuse that rotator cuff, even though you did the chromioplasty and so forth, you can still get inflammation in a rotator cuff, right, and it needs to be appropriately treated. So anyone who had surgery and you did well for the first 2 years or whatever, and then you go out and you do something you haven't done. Like, I know during the springtime, I mean, my 10-year-old, Austin, or playing my 7-year-old Carly, if I'm throwing the ball with them for 20 minutes, the next day I'm sitting there going, oh, my shoulder hurts. And even if you had surgery on it, it's going to hurt the next day.
You're not the bionic man.
Yeah, exactly.
All right, 2 minutes, and let's talk to Robert in Chester. Robert, go right ahead with your question.
All right, thank you. Doc, how you doing tonight?
Good.
I'm a 44-year-old fireman, and I suffered a dislocated shoulder with a fracture. Subsequently, I went into surgery with Dr. Wolf from Premier. Unfortunately, I have Keystone East at HMO, who's not very aggressive with their physical therapy benefits. And my question is, what does the physical therapist suggest beyond the basic exercises that a man of my age should do to get back, if I'm still not back to full duty?
Let's ask that one to Dave.
Well, you'd be a perfect person to take advantage of the free screening, first of all, to see what level you are at. And at that point in time, we can give you some suggestions. You really want to work on what your limitations are. I mean, you really, if the therapist got you to the point to where you're into some of the real good strengthening exercises to stabilize the shoulder joint, as we were talking about earlier, how important the muscles are to support and stabilize the shoulder joint, you really need to get into doing those exercises. So if he explained to you how to do those and put you on a good home exercise program, you definitely need to be doing those things. But the best thing to do is, without really going into detail, I really need to know where you're at. So if you could come in for the free screening, I'd be glad to do it for you and take a look at it and give you some more suggestions at that point.
Robert, you might want to schedule that appointment in Pennsville. You are in Chester. The toll-free number there, or the number there to schedule an appointment, is 856-678-8000. In Woodbury, it is 856-853-0988. Sicklerville, 856-728-1900. And in Washington Township, 856-374-3707. This is for the free screening offer from Cross Keys Physical Therapy. I want to thank our guest, Dr. Merrick Wetzler, orthopedic surgeon from South Jersey Orthopedic Associates in Washington Township and Voorhees, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Until next time, I'm Joe Chapana. Stay well.